Health disparities. Difference in overall rate for the incidence and prevalence of disease compared to the general population. Unequal representation of a group's morbidity, mortality, or survival rates. Cultural competence. Ability to recognize individual patient perspectives about health and provide patient-centered care within the context of their cultural beliefs. Social determinants of health. Health equity. Healthcare accessibility barriers. Linguistically and culturally congruent care. Health status. Vulnerable populations. Community health assessment. Levels of prevention. Health literacy. Degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate healthcare decisions. Health beliefs, behaviors, and outcomes. Language barriers can contribute to medication non-adherence, missed appointments, increased ER visits, and hospitalizations. Risk factors for literacy. Older age, low socioeconomic status, membership in a minority group, general illiteracy, English as a second language. Most common barriers for pharmacists. Language, socioeconomic status, culture. Medication management process was introduced to provide a conceptual framework for investigating activities associated with use of medications to ensure proper use, avoid errors, achieve desired outcomes. Every institution is required to have a medication management policy and procedure that is organizational owned. Pharmacists have a key role in development and maintenance of medication management process. Define selection. Determining what to carry in pharmacy inventory. Define procurement. Processes involved in obtaining your inventory. Purchasing, shipping, receiving, and processing includes the function of buying products and services for a specific business purpose. Define storage. Physical means and procedural processes involved in storing, securing, and protecting your inventory. Order of supply chain management. Manufacturers, distributors, healthcare providers, patients. Define demand management. Methodology used to generate, revise, and improve a demand forecast of the products and services that the organization will provide to customers. Define inventory management. Methodology used to control inventory and stock, including controlling inventory levels and overseeing orders and storage of inventory. What is the goal of inventory management? Meet sales and customer service levels at optimal cost. Define sourcing. Methodology used to identify and manage the right product suppliers, considering vendor capabilities, pricing, and service levels. Define purchasing. Process used to finalize order quantities, order and receive the products. What questions are used in demand planning? What products, which amounts when needed? Inventory selection is highly variable and depends on type of pharmacy and permit customer base and location formularies and contracts, types of drugs and devices. Institutional Class 1 Pharmacy. No medicinal drugs dispensed includes SNF, ALF, jails. Institutional Class 2 Pharmacy. Most common only covers at that building, nothing leaves premise. Modified Institutional Class 2 Pharmacy. Smaller than regular Type 2 defined by A, B, or C. Type A Modified Class 2. No more than 15 drugs in formulary. Type B Modified Class 2. Medicinal drugs stored in facility in patient-specific form and in bulk form and has an expanded drug formulary. Type C Modified Class 2. Medicinal drugs stored in facility in patient-specific form and has an expanded drug formulary. How can controlled substances be ordered in institutional pharmacy? DEA Form 222 or XOs. What is XOs? Controlled Substance Ordering System, electronic process to order controls. Single unit package contains 1 discrete pharmaceutical dosage form. Unit dose package contains the particular dose of the drug ordered for the patient. Oversight of a pharmacy is required in purchasing inventory when drug substitutions needed during shortages, controlled substances involved, investigational drugs involved, dealing with restricted distribution medications. Advantage of direct purchasing. Decreased costs. Advantage of indirect purchasing. Consolidated ordering, increased efficiency, less staff time and cost from bulk same next day delivery. Disadvantage of direct purchasing. Increased staff time, delayed delivery, drug shortages. Disadvantage of indirect purchasing. Increased cost. Discounts from primary vendor can come from quantity ordered, bundle, cash. Advantages of GPO. Standardize inventory, drug cost reduction, labor cost reduction. Disadvantages of GPO. Less control over purchasing process, formulary restriction. Cost of purchasing equals acquisition cost equals. Includes cost of product, wholesaler, manufacturer, markup, discounts offered. Procurement costs equals cost of shipping, receiving, stocking, and bookkeeping of inventory. Carrying costs equals costs inherent in the product and often difficult to quantify. Total costs include acquisition cost, procurement cost, carrying cost. Ordering inventory is based on intuition and economic order quantity. Define reorder point. Point at which you need to reorder inventory to assure adequate supply for the customer. Define ITR. Inventory turnover rate measures how fast inventory moves. Ideal ITR 8-12x per year. ITR equals total cost of goods divided by average inventory value. 8 steps of the medication management process. selection, procurement, storage, ordering, prescribing, transcribing, verifying, dispensing, delivery, administration, monitoring, reporting. 2 parts to prescribing include decision and informing. Components of an order: drug strength, dose, route, frequency, duration, PRN, qualifier, indication. Hospitals can restrict prescribing authority based on licensure, training, patient population, drug category, class. Define transcribing: act of copying the prescriber's order from original source into another data source system. Define verifying: review of the order. Examples of type of clinical alerts: drug disease contraindication, drug dosage modification, drug-drug or drug-food interaction, drug patient precautions, inappropriate duration, drug environment interaction. Dispensing does not include delivery of medications to patient care areas. What are the 7 rights of medication administration? Patient drug dose, route, time, indication, documentation. What is smart pump technology? Dose error reduction software includes dosing guidelines. Examples of environmental control: temperature, humidity, air pressure. What goes into quarantine area? Expired, waste, damaged medications. Define white bagging. Requires providers to order the therapy from a specialty pharmacy outside their own health system and is seen by providers as more inflexible than the traditional system. Define brown bagging. Requires the patient to purchase the specialty medication and then take it to their provider for administration. Combat Methamphetamine Epidemic Act does not apply to institutional unless they operate their own community pharmacy. EFORCSE requirements do not apply to institutional except for ambulatory care, e-prescribing of medications to community pharmacies. What does pharmacy practice include? Operational, clinical, administrative services. 3 pharmacy practice model examples: pharmaceutical care model, clinical pharmacy model, drug distribution model. Pharmaceutical care model includes integrated practice model. Member of interdisciplinary team includes most pharmacists, patient-focused. Clinical pharmacy model includes rounding with little distributive functions. Pharmacist acts as a consultant, requires specialized skill set, focus on quality care. Drug distribution model includes medication order focused, no direct patient care, no involvement in patient outcomes, focuses on timely delivery. Floor stock system includes individual storage or on each nursing unit. Regulatory requirements require double lock. Decentralized form of distribution. Pharmacy's role is primarily distributional. Pros of centralized pharmacy: control of resources, maintain standardization, simplify supervision, control distribution, less capital outlay for automation, supportive of night shift. Cons of centralized pharmacy: less face-to-face with other healthcare providers, increased delivery time, less utilization of automation, restrict pharmacist and technician ability to expand skills. Pros of decentralized pharmacy: More face-to-face with other healthcare providers, reduce delivery time, utilization of automation, provide pharmacist and technician ability to expand skills, ready access to providers. Cons of decentralized pharmacy: expanded need versus duplication of resources, less control over standardization, limited direct supervision, increased capital outlay for automation, shift to centralized for night shift security. Define pharmacy services: action or set of actions to optimize process of care with the aim to improve health outcomes and the value of healthcare. Define pharmacy operations: management of drug products and services align with the vision, mission, and values of the organization. What are clinical pharmacy services? Provide patient care that optimizes medication therapy and promotes health, wellness, and disease prevention. Clinical pharmacy services are activities and processes that ensure optimal therapeutic outcomes, minimize ADE, promote cost-effective strategies, engage in interprofessional activities. Define MTMS. Medication therapy management services. MTMS are independent of but can occur in conjunction with the provision of a medication product. Define MAR. Medication administration record of all current medications prescribed for each patient. Define medication profile. Primary record that pharmacists use to document patient medications utilized during order transcription or verification of the medication management process. Define formulary. Evidence-based, continually updated list of medications and medication-associated products accepted for use within an organization. Formulary also includes medication use policies, important ancillary drug info, decision support tools, organizational guidelines. Types of formularies: open, closed, mixed. What is the most common type of formulary? Mixed, hybrid of open and closed. 3 tiers of mixed formularies: open, restricted, targeted. Define targeted formulary. Medication requires approval prior to dispensing. Define formulary system. Ongoing process that establishes policies regarding the use of drugs, therapies, and drug-related products, identifies those that are most medically appropriate, safe, and cost-effective. Define policy. Formal statement of a principle that should be followed by its intended audience, identifies course or plan of action that must be taken, thou must. Define procedure. Provides detailed mandatory steps someone needs to follow to achieve a recurring task or comply with a policy course of action intended to achieve results, and provides detailed processes, thou shall. Define standard. Specifies uniform uses of specific technologies or configurations. Define guidelines. Provides general guidance and additional advice and support for policies, standards, or procedures. P&T Committee is responsible for managing the formulary system, provides an evaluative, educational, and advisory service in all matters related to medication use. P&T is a blank and not a pharmacy committee. Medical Staff Committee. Define drug monographs. Written, thorough, unbiased, evidence-based review of medical literature. Drug monographs should be initiated and completed. Requesting healthcare provider. What percentage of savings can hospitals receive in pharmaceutical purchases from 340B program? 25 to 50%. 340B program is only applicable to medications from ambulatory care covered entity. What are some possible formulary decisions? Addition without restrictions, addition with restrictions on prescribers, patient types, addition with required approval prior to dispensing, reject medication for formulary addition. Define MU. Medication use evaluation, systematic and interdisciplinary performance improvement method with overarching goal of optimizing patient outcomes via ongoing evaluation and improvement of medication utilization. Drug use evaluations are required by blank to monitor safety of medications. The Joint Commission. Criteria for selecting medications to perform MU on should be based on whether medication is high use, high risk, high cost. What is a requirement for demonstration of value-based care? Documentation of services. What are the 4 stages to developing plan for new clinical services? Complete assessment of current clinical services, review of literature supporting clinical services, development of clinical services, implementation and assessment of new services. What is a key marketing principle for any good or service? Continuous evaluation and re-evaluation. What is necessary in development of new services? Clear vision, mission statement. What is the most difficult phase of implementing new services? Implementation and monitoring.